Tendons are built to withstand immense forces. When they sustain an injury, they actually require high-intensity mechanical loading to rebuild their structure. The physiological requirement for remodeling is heavy resistance, typically 70 to 85% of your 1-rep maximum. But an injured tendon often cannot endure that much weight without triggering an acute, limiting pain response. If you avoid the heavy load, the tendon lacks the physical signal it needs to heal, and the surrounding muscles begin to rapidly lose strength and mass from disuse. This leaves the athlete stuck. You have to load the tissue heavily to recover, but the tissue itself physically rejects the weight required to do the job. Attempting to push through the pain risks further damage, while resting ensures a permanent drop in athletic performance. There is a clinical method to bypass this heavy mechanical load requirement entirely: blood flow restriction, or BFR training. BFR involves applying a specialized medical-grade pneumatic cuff to the upper portion of a limb during exercise. Look at this Prisma flowchart from a 2025 scoping review by Oberg and colleagues. This outlines the systematic filtering of clinical data used to evaluate how BFR impacts tendon rehabilitation across 19 distinct peer-reviewed studies. The data collected here reveals a specific pattern. Applying BFR while lifting low loads, just 20 to 35% of a 1-rep max, produces strength and tendon adaptations comparable to lifting those heavy 70 to 85% loads. Clinically, this makes BFR an effective bridge during the first and second phases of rehabilitation, exactly when pain prevents an athlete from executing a traditional high-load program. Think of it like a volume knob. You are turning down the external mechanical weight to a safe level, but you are turning up the internal metabolic stress to keep the overall biological signal identical. You are still doing the work. You are just using a biochemical backdoor to achieve the exact same tissue adaptation while staying safely below the tendon's mechanical pain threshold. Here is how the biology actually works. When the cuff inflates around the proximal thigh, it allows arterial blood to enter the leg, but it compresses the veins, heavily restricting the blood from leaving. You have created a vascular one-way street. Blood and cellular byproducts enter the working muscle, but they cannot escape. As you perform light resistance exercises in this state, the normal byproducts of muscle contraction begin to accumulate at an extreme rate. The muscle becomes flooded with lactate and hydrogen ions, rapidly dropping oxygen levels and creating a highly acidic cellular environment. This intense, localized metabolic stress immediately sends an urgent distress signal straight up the spinal cord to the central nervous system. The nervous system interprets this acidic buildup as a sign of imminent failure. To survive, it forcefully recruits large, fast-twitch type 2 muscle fibers. Under normal conditions, these powerful fibers remain dormant during light exercise. They typically only activate when you attempt a massive maximal lift. Over several weeks, repeatedly triggering these high-threshold fibers forces the cells to synthesize new proteins, increasing the mass of the quadriceps and signaling the tendon to structurally remodel. BFR uses localized chemical stress to trick the central nervous system into reacting as if the body is lifting a dangerously heavy weight, entirely bypassing the need to put actual, dangerous tension on the injury. Knowing the biology helps, but it is important to set expectations for the physical reality. Lifting light weights under occlusion does not feel light. Within the first 2 sets, the accumulation of acid triggers an intense burning sensation and a level of deep, localized fatigue that feels entirely disproportionate to the actual weight you are moving. You will also experience a massive cellular swelling, often called a pump, driven by the trapped intracellular fluid and metabolites expanding the muscle tissue. Enduring a BFR session is largely an exercise in psychological tolerance. The physical weight on the machine is low, but the internal discomfort is exceptionally high. This artificial distress is the biological price required to protect your injured tendon from mechanical overload while still forcing rolling to grow stronger. To achieve these specific physiological effects, clinical BFR training follows exact parameters. First is the load. The resistance must be strictly locked between 20 and 35% of your measured 1 repetition maximum. Second is the time. The standard protocol demands 4 sets of 30, 15, 15, and 15 repetitions, with the rest period between those sets restricted to exactly 30 seconds. Third, and most importantly, the cuff must remain fully inflated during those short 30-second rest periods to guarantee the metabolites cannot escape the muscle. Finally, the pressure of the cuff itself is governed by a precise metric known as limb occlusion pressure, or LOP. A clinician uses a Doppler ultrasound device to find the exact amount of pressure required to completely stop blood flow in your specific leg. Once that baseline is established, the actual working pressure for your exercise session is mathematically set to between 40 and 80% of that individualized number. Remember, the occlusion is simply an amplifier. If your exercise tempo is erratic or your form is poor, the cuff is only going to amplify a bad mechanical signal. Even a perfect mechanical signal is only half the equation. Once the tendon receives the message to remodel, it needs biological substrate to execute the order. Loading a tendon is essentially placing an internal work order for new tissue. The body cannot fulfill that request without a supply of physical building blocks. To feed the tendon, we introduce a specific, timed nutritional intervention. The clinical dose is 15 grams of hydrolyzed collagen paired with 50 milligrams of vitamin C. You consume this mixture exactly 60 minutes before your rehab session. This specific timing ensures that plasma amino acid levels peak precisely when the mechanical load hits the tissue. This targeted strategy only functions if your foundational diet is solid. It requires a total daily protein intake between 1.6 to 2.0 grams per kilogram of body weight to provide adequate energy availability. When you stack these tools together, combining the intense mechanical signal of BFR with the precise substrate timing of collagen, you can effectively double the tissue synthesis response of every single rehab session. Because BFR aggressively alters human physiology, it requires strict medical supervision. You cannot simply buy a restriction cuff online, strap it on, and guess the pressure by how it feels. Using uncalibrated equipment or estimating the compression carries serious risks, including tourniquet-related nerve injury and permanent vascular damage. There are absolute clinical contraindications. Patients with active or prior deep vein thrombosis, severe hypertension, or peripheral vascular disease are disqualified from this protocol. Under clinical guidance, your job is to track the variables you can control, monitor your subjective pain, complete all 75 prescribed repetitions, and record the exact occlusion pressure your physical therapist sets. Blood flow restriction and targeted collagen supplementation are precision clinical tools designed to hack your body's adaptation pathways. By intentionally manipulating metabolic stress and supplying the exact biological building blocks your tissue needs, you can rebuild your tendon's resiliency and maintain your performance edge, even when your injury prevents you from lifting heavy.